Defining quality of care within the healthcare system is a very difficult challenge because it really depends upon the conditions that we're speaking of. It depends upon not only looking at the clinical standards or clinical outcomes, but also looking at the impact of disease to productivity of the individual. And so as we look at the performance of physicians and the performance of certain interventions, it's important to look at the cost of individuals with illness and not just the cost of the illness in measuring the efficiencies of the system and the individuals providing care. Consumers will have to take more responsibility in terms of understanding what it is that their behavior or their routines or habits are having on their predilection for developing disease. And so they will have to get better informed about the risks of what's going to cause diabetes or what's going to cause cardiovascular disease or other conditions, know how they can prevent the onset of those conditions, be better advised on how they can be more compliant with their medications, and also get better educated in terms of the benefits and the cost of their future treatment and how they're going to manage that. As employers are having to take on more responsibility, or there is a mandate for consumers to take on more insurance or to pay more, they're going to have to get better educated in terms of what it's going to cost. It's possible that the government will assume some responsibility in terms of making sure that everybody has insurance through some shared responsibility of the employers who will provide coverage. But there will be a certain responsibility entrusted upon the individual that will be either in the form of money or other resources that are given to them in terms of a savings account or otherwise that says that we are now allocating this resource to you to manage your condition or to prevent you from getting this condition. And it will be the consumer's responsibility to understand what resources are available, what they may be spending in the future, and how within their budget they're going to be able to provide for themselves and for their families.